Latuda is not for everyone. Call your doctor about unusual mood changes, behaviors, or suicidal thoughts. Antidepressants can increase these in children, teens, and young adults. Elderly dementia patients on Latuda have an increased risk of death or stroke. Call your doctor about fever, stiff muscles, and confusion, as these may be signs of a life-threatening reaction. Or if you have uncontrollable muscle movements, as these may be permanent. High blood sugar has been seen with Latuda and medicines like it, and in extreme cases can lead to coma or death. Other risks include decreased white blood cells, which can be fatal, dizziness on standing, seizures, increased cholesterol, weight, or prolactin, trouble swallowing, and impaired judgment. Avoid grapefruit and grapefruit juice. Use caution before driving or operating machinery. There are paths to treat bipolar depression. Ask your doctor if once-a-day Latuda for bipolar depression is right for you.
Peace, people. My name is Kamani Mokajade, Kamani Jade for short, and you tuned into More Lyrical. And I'm here bringing to you honest, transparent, truth-telling, and great conversations on mental health in the spirit of healing justice. And today I wanted to talk to everyone about what it's like being on psychiatric medication. In particular, bipolar medication. Now, I've had bipolar 1 disorder for about 16 years, and I've been on many medications since. When I first was diagnosed in Barbados in 2005, I was put on a pretty heavy dosage of lithium. And being on a first generation dosage like that, especially being 5'7" and about 3/4 inches, and at the time 125 pounds wet, it was a lot in my system, and I found myself being so heavily sedated, it felt like I was the walking dead. I was just a zombie walking through the streets of Barbados. I remember it feeling like I had a stroke on the left side of my body. It was so bad, I was drooling out of the side of my mouth, and I couldn't really come to. It was as if I had been given horse tranquilizers. And this was my first experience on any type of psychiatric medication. So you can imagine, moving forward, it was pretty difficult to get me to comply to anything else. After that, I was placed on Seroquel. And I remember being in the hospital, sleeping for an hour. Getting up felt like having to pull my entire soul up out of my body with me. And when I did wake up, I was carrying the weight of all the generations that came before me. That is how heavy I felt in my body. I couldn't stay on Seroquel. For a lot of people it works. For me, it was just too much. It was deeply impacting my ability to function normally or to do anything with my day. After that, I was put on Risperidone or Risperidol, the brand name for the drug. And it wasn't as bad as Seroquel, but it also wasn't much better. The sedative effect just had too much of an impact for me to really feel comfortable staying on that medication. And all of this was over 16 years of my diagnosis. Eventually, I was given Abilify, and I liked Abilify because I couldn't feel it in my system. And so it encouraged me to take it on a daily basis. However, I quickly learned that Abilify in my body was a surefire way to gain weight. In about 4 months, I gained 40 pounds. So I definitely wasn't staying on that. After all of these ups and downs with medication, I began researching bipolar medications myself. And I came across a drug called Topamax, which also happened to have the side effect of losing weight. It seemed perfect. However, what I found while taking it was my fingers and my feet kept tingling, and I just couldn't stay on that drug either. Eventually, I was given Lamictal. Lamotrigine is the generic form of the drug, and I've been on that drug ever since. I've been on it for at least 6 years, and it works for me. I can't really tell that it's in my system, so when I take it, it could very well be a placebo. I wouldn't know the difference. But what I do know is it helps me stay stable throughout the year, which is all I ever want. But if you've been watching my videos, you know this year's been pretty difficult for me, and for the first time I decided I need more than a mood stabilizer, and so I've been trying out new drugs. I typically don't take antipsychotics outside of the hospital. My maintenance medication looks like mood stabilizers. I most recently tried Latuda, and I hadn't been on it for quite long enough because it's a newer generation medication, which means it isn't often approved by insurance plans. While I was able to get it approved, the back and forth was just discouraging. And so I decided to go back to Abilify, and I'm on it now. And what that means to me is I have to be uber conscious of what I eat and increasing my fitness levels throughout the week, which, as you know, isn't always easy. But I also don't have any more room for weight on my frame. And so we'll see how it all works out. For me, taking medication isn't as simple as popping a pill every day. When we watch these drug commercials, we know that those side effects would freak anyone out. So it's not a matter of just take your medication. And if you're not, then you're being irresponsible and you want to get sick. People who think like that are often coming from a position of ignorance. These side effects are real. They impact you on a daily basis. No one wants to feel sick trying to get better. Beyond that, one of the biggest challenges for me taking psychiatric medication is knowing that it is having a lasting impact to my body. So much so that it's not approved for pregnant women. So what does that mean for me, who does want to have children, when I have to change medications to find one that is approved by the FDA to take while you're pregnant? Do I take medication at all? These are all questions that each person has to decide for themselves in their personal journey, but it's not easy. Either way, I'm glad to have found the cocktail that works best for me. And I hope that if you're taking psychiatric drugs, you find the medication or combination that works best for you. If you've made it all the way to the end, go ahead and subscribe, because I'm posting more videos just like this, just for you. And be sure to like the video too. Peace, people.